You are listening to New Reflections with Dr. Adam Rubenstein. If you have a question or comment for the host or this week's guests, please call 1-866-472-5792. Again, that's 1-866-472-5792. You can also send an email to info@dr-rubenstein.com. That's info@dr-rubenstein.com. Now, back to New Reflections.
Welcome back to the show. We're talking on New Reflections about scar treatments. This week's episode is called Heal Thyself, talking about scar treatments. We've had a great discussion with Zubin Meshkinpush from Inaltis. We've got Z Product from New Medical Technologies. And now I'd like to introduce our third guest, Dr. Michael Longacre. He's a professor of surgery at Stanford University. He's also one of the co-founders of Neodyne. They are the makers of a new type of dressing called Embrace. Dr. Longacre, welcome to the show.
Thank you. It's nice to be here.
Well, thanks for calling in. Thanks for giving us your time. We were just talking for a while about topical ointments, and we got onto topical sheeting, and Embrace is sort of the next step. Tell us about Embrace.
Well, Embrace is a product that Neodyne launched maybe 10 months ago. It's a dressing that goes on sometime when there's a dry, clean wound in the judgment of the surgeon, and then is worn for a week at a time for 8 weeks. So most surgeons put it on any time between day 2 or 3 or 14, whenever, depending on the procedure. It fundamentally is a material science play in that it goes on, simply put, in a large configuration. It's clear, like a Tegaderm type dressing, and then when it's released onto the patient, it immediately reverts to a smaller size. So it kind of borrows from Peter to shield Paul. So the wound that's healing is not exposed to the forces that spread the scar and make it thicker until the scar is as strong as it's going to be, which is about 10 weeks or so. So
okay, so we were talking about the wound healing, and you're kind of getting into a couple of things that we should really point out. When you have a wound, particularly, and we just talked about tummy tuck wounds. That's a perfect one to discuss. So if we make an incision and perform a tummy tuck, one of the things that we've already talked about with scar formation is, of course, keeping it moist, keeping it sealed, and the big thing that creates a thicker or wider scar that we haven't talked about yet that you're touching on is tension. You know, for a tummy tuck particularly, we're taking skin that's just sort of sitting there, and we're cutting out excess skin and making it a really tight place. And there's tension on there. There's tension because we've made it tight. There's extra tension because there's swelling, which is pulling on the wounds. And so one of the reasons that people get wider, thicker scars is that the wounds have these forces pulling it apart, even though the stitches on the inside and on the outside, all the layers of stitching are trying to keep it together. And the whole key as plastic surgeons, using our technique, is to try and minimize the amount of tension on the wound. So what Embrace, it sounds like it's designed to do, is just that, to decrease the tension on the wound.
That's correct. So just a couple points, and Adam, you know this as a plastic surgeon. So when you incise, if you have a C-section or heart surgery, you're not excising a bunch of tissue. You have a line, and it gapes open a little bit, and it gapes open a little bit because we're not jellyfish. There's residual strain. But when you cut out a football-shaped piece of skin and soft tissue like you do in a tummy tuck, the surgeon reopposes the dead space, but it doesn't offload the tension per se. In other words, if you cut the sutures, it'll pop open again. So fibroblasts come in, begin to heal that wound at about day 4 or 5, but it's not as strong as it's going to be for about 10 weeks. So during that time, it's not as strong as you say, the force is pulling it apart. That's why wounds spread and get thick. So this product is designed to shield it from those things until the wound is as strong as it's going to be at about 10 weeks.
Okay, so at base, Embrace is a silicone gel sheet, correct?
Yes. I should be clear that when we did different strain offloads, when we have no strain offload on the silicone sheet, there was no efficacy. So it's a material science play. Silicone sheeting was used because of a safety and long track record for the FDA. But the silicone is not relevant to the efficacy of strain offloading.
Okay, so it's a little bit different than, say, the new Gel Plus, where the whole purpose is the application of the silicone directly. This is a different use of the silicone. You're using it because it's elastic, and you need something that's going to be stretchy that when you stick on the wound, it's going to have the ability to pull things.
Correct. And in the FDA's mind, there's a long track record of safety for silicone. For us, it's an elastomer, as you say, that goes on and can be preloaded and revert back to a small size.
Okay, so really, this is a little different than something like Biocornium or New Gel Plus, which is relying on silicone. You're relying strictly on just the mechanics.
Correct.
Okay, so take us through how Embrace works. What is it that is actually doing it? Take us through having a sheet in front of us, and we've got this tummy tuck scar. It's 2 weeks after surgery. What do you do?
So it comes out of the package, and you open it like a book. And when you open the dressing like a book, because there's a little cardboard backing on it, you are now loading it, Adam. You're making it larger.
Okay.
So you're kind of opening the book on scar reduction, so to speak. So now it's in a larger configuration. You turn and put that now down in the patient and take the backing off, and that's it. And it immediately, in milliseconds, reverts. You don't feel it to a smaller size. It's a little thicker than a tegaderm, and that's really it. Activities of daily living are normal.
Okay, and so you take this, you say, like a book, open it up, and the act of opening is what's stretching it. And then once it's all stretched out, you keep it that way, press it against the skin, and when you release the dressing backing, then it wants to revert back. It kind of squeezes itself back down to the smaller size and takes the skin along with it.
Correct. So, but it's in other words, bringing in the surrounding tissue, kind of what you would remember as a Montgomery strap, meaning it's way away from the incision.
Wow, well, you're going way back in surgical history as far as I'm concerned, because Montgomery strap, I guess they still use them in trauma surgery, but those are things, just for those of you listening, a Montgomery strap, it's a really old dressing at this point that used to have, basically it was like a tape with shoelaces on it. And you would put tape on either side of the wound. So, let's say we go back to that, the sternotomy, the open heart scar. You might take these Montgomery straps, and usually they were used in belly surgery, but figure you have this scar, and you put these broad pieces of tape on both sides of the wound, and it's got these shoelaces, and that's pretty much what you're doing. You're lacing up the outer skin, and as you tighten those shoelaces, it pulls the skin inward towards the opening of the wound. So, that's what we're doing with Embrace.
Right. Those are very large open wounds in closure. Embrace is put on after closure, but it's a principle of shielding the wound and the scar that forms until it will be as strong as it's going to be, which is about 10 weeks. Otherwise, it's simply not strong enough to fight the forces that pull it apart. And I'll have to say, based on 25 years of research by myself and Jeff Gertner, another co-founder, is that tension and mechanical forces, Adam, prolong inflammation, and that's the driver of the thick spread scar. Okay,
so really you think by taking the tension off the wound, additionally, besides good surgical technique and using good layered closures, trying to keep the tension to a minimum, no matter how much we try, you can't take all the tension off a wound. So by using something like Embrace, it's almost like having someone standing there with their hands on both sides of the wound, pulling it together for you full time, which, that'd be great, but, obviously it's not practical.
Right, and it's precise, and in the indication you're talking about, which is under a lot of tension, that's where we did the randomized controlled trial. And it was, highly, highly effective with 13 surgeons in 2 states. And what they did on the other side, Adam, was whatever worked best in their hands during 13 years of practice. And it was not close at the end of a year.
Interesting. So what you're saying is, and I've seen these pictures. For those of you who are listening, Dr. Longacre is talking about studies that were done with Embrace. And the idea was that you'd take a tummy tuck scar, and during the healing process, you put it in the hands of a dozen or so surgeons and said, here, use this on the right side and use whatever you normally do on the left side. And Correct. You were looking at the pictures and comparing them. What did you see?
When you compare those pictures and ask plastic surgeons unrelated to the study to look at them, at a year, the statistical analysis where you put 1 as a great scar, 10 as an unattractive scar, it was highly significant, the difference both at the end of therapy, 8 weeks of treatment, and at a year. And there was no loss of benefit. It becomes more favorable. But call me crazy. The wonderful thing about a tummy tuck, as you point out, is you can have the same patient for 2 sides. So there's no variability patient to patient. But it's also under enormous amount of tension, so it's challenging. These surgeons thought we were a little crazy because they had a week head start or 2 weeks head start with whatever they did in the operating room. So there's one thing to look at pictures, but it's another thing, Dr. Rubenstein, to say, okay, what does it look and feel like to the patient who examines themselves and the treating surgeon? So there were 2 additional analyses done because you have 3 dimensions and you go through 8 things, pain, thickness, itchy, whatever. That was at about 100 times statistical value difference at a year.
That's amazing. So really, like the other things we were talking about with the new Gel Plus, with the biocorneum, you're looking at an 8-week, essentially 2 months worth of therapy. So on all these products, we're looking at really using it for maybe 2 to 3 months, even out to 6 months with some of them. But you're seeing the benefit that lasted out to a year that you think just continued because you set it up right in the first place. Correct.
If you get it right, so the scar, once it gets to be as strong as it's going to be, that's really when the spreading, if you will, is going to stop because now it's at equilibrium. And the thought is you just reset it. The other thing we did, and I don't know if you've talked about it today, is there's a large body, 2 things I think are important for patients to know. Patients put on almost $1.9 billion of products in the first year after surgery in the U.S. to minimize their scar. So they're doing a lot of things. There's a big need and a big appetite. The second thing is there's also a lot of existing scars that have already had surgery. 80 million operations a year in the U.S. and somewhere around 10 million lacerations. So existing scars are another thing that are very important to patients because few of them define themselves by their scar like Harry Potter positively. So we did a second randomized controlled trial on scar revision, which, as you know, is not something plastic surgeons like to do because a year later it tends to look like it did before you paid for it. So that was only 10 patients. And that was also highly significant. The whole scar was excised under lidocaine. The device of Embrace was put on half the revision, and then standard of care for the surgeon on the other half, which is not what you do in your office, but that's what the IRB demanded. And at 6 months, it was highly significant.
So this is important. This is important. I want to make the point that, what we're talking about, Dr. Longacre is mentioning old scars, and certainly there's lots of them. And, that's where we have a lot of frustration because, the horse is really out of the barn at that point. The scar is healed, it's done, and there's not a lot we can do. I mentioned in the beginning of the show laser resurfacing and dermabrasion. You can blend things a little bit, but once you have the scar, it's there, and the quality of the scar cannot really be improved that much with anything that we've got today. But what Dr. Longacre is saying is not to take Embrace and use it on that existing scar. We're talking about removing the scar and closing the wound again with good technique. Now, there's a little bit of an advantage there because usually there's more inflammation when you have your original injury. You're probably more swollen. It's probably done for something that's a bigger deal than just removing a piece of skin. So we're in a better situation when we do a scar revision, generally speaking, because all we're doing is taking out a little sliver of skin and then bringing it back together. Correct. But then, if you add to that the use of Embrace, you're going to be reducing the amount of tension significantly compared to what you had from way back when it originally happened.
That's correct. So if you everyone looks at their index finger, that's a pretty wide scar. But as Dr. Rubenstein points out, if the tummy tuck excision, which may have been 8 or 10 inches in diameter, led to that width of a scar, then just putting lidocaine in and excising less than a centimeter and doing the Embrace would be a home run. And that's, in fact, what it is. So now, for the first time, instead of avoiding scar revision, because now the patient is disappointed on your blade, so to speak, now you really have an opportunity to change the biology. And that's really what plastic surgeons are looking for. Because a nice scar revision, Dr. Rubenstein, as you know, it looks beautiful on the table. A year later, you're disappointed. But now you have something in the armamentarium that says, okay, I'm going to significantly improve this result.
That's pretty exciting. Well, we're going to take one last break. When we come back from the break, I want to talk to all three of you about ways that we can use these things together. What's the future? What are we looking at in the next 10 years in terms of scar therapy? Stick with us. We'll be back in just a few minutes after this short break on New Reflections.
Real Life Solutions. Voice America Health and Wellness.
Explore the power of natural healing with Howard Strauss. Join us each week for an informative program that'll help you learn effective healing methods using natural remedies. Howard's guests include top researchers, authors, and experts who will share their views on a variety of natural products and healing methods that really work. Tune in to The Power of Natural Healing with Howard Strauss, Mondays at 11 a.m. Pacific Time, 2 p.m. Eastern Time on the Voice America Health and Wellness Channel.
Leadership is a destination, but how do you get there? More importantly, how do you maximize your power and influence and develop more leaders in your organization? Learn from proven leaders and proven practices. Join Doctors Kathy Greenberg and Relly Nadler for Leadership Development News. This program will help you develop the next leaders in your organization, balance your work life, manage your boss, and manage yourself. We'll feature cutting-edge interviews with industry experts and authors. Leadership Development News, every Monday at 9 a.m. Pacific, noon Eastern on the Voice America Business Channel.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You are listening to New Reflections with Dr. Adam Rubenstein. If you have a question or comment for the host or this week's guests, please call 1-866-472-5792. Again, that's 1-866-472-5792. You can also send an email to info@dr-rubenstein.com. That's info@dr-rubenstein.com. Now, back to New Reflections.
Welcome back to the show. I'm Dr. Adam Rubenstein, board-certified plastic surgeon and host of New Reflections. We've been having a terrific conversation about scar treatments. Really interesting stuff. We've come a long way from the early years of honey and earthworm juice and head and feet of castrated sheep. Now, it's a lot more science involved today. We've been talking with Zubin Meshkampush, who's the COO of Analtis, about his product Biocornium, with Z Product, who's a regional director from New Medical Technologies, and talking about New Gel Plus, their topical sheeting and ointments, and now just recently with Dr. Michael Longacre, who is the founder of Neodyne, the makers of Embrace, a new dressing to help decrease tension in wounds. So, Dr. Longacre, we just finished talking about how your product works and what the idea is. It's very exciting. I think mechanically it really gives an advantage where we've had a disadvantage. We've been fighting that disadvantage as plastic surgeons for a long time. Tell me, because the type of silicone sheet you're using is not intended to have the topical benefit of silicone itself, as we see with things like Biocornium and New Gel Plus, is there a way, do you think there's a role for using a thin application like a New Gel Plus or a Biocornium underneath Embrace?
Well, I think it's possible. I don't have any data, so I always like to stick to the data. I think I think it's possible. There are a number of products, and including the products that your other guests have, that are put on as a topical, so to speak. So, there'd be no reason to expect that there'd be a negative effect of doing both. But that's an opinion. I haven't done it, and I have no data to support that.
Okay. Well, Z, what do you think? You think that, now remember, the Embrace product, it's a lot wider than the type of silicone sheeting that we were talking about with New Gel Plus. So, maybe a thin layer of the New Gel Plus sitting on top directly on the wound and then throwing Embrace over it. What do you think?
I'm not too familiar with the Embrace product. It is relatively new. Does it go on immediately after surgery, or does it also have to go on a closed, dry wound?
Much like all the other products, all of your products that we've been talking about, the recommendation is to wait maybe 10 to 14 days after till you have a closed wound.
Yeah, I don't see it hurting. If anything, I see it could help.
Okay. Zabine, what do you think?
Just so the other speakers know, by at the end of the year, we'll have a sterile product with microperforation. So, should the surgeon want to do it, like for an indication, like after general surgery or heart surgery, they could put it on sterile at the time of wound closure. But we do not have that yet. I think biologically, there's no reason to expect that it would not. There might be some synergy there. There's no. I don't have the data, but why wouldn't it be helpful?
Right. Well, that's my feeling. What do you think, Zabine?
Yeah, I agree. I agree. I mean, we're always trying to improve how the scar looks, and I think you alluded to it at the beginning. The more different approaches we can take, the better to kind of check off the different boxes. And obviously, tension plays a huge role. And I like the Embrace product. So I would think, like Dr. Longacre said, there's certainly not going to be harm and potentially a synergistic effect or a compound effect that can only increase the aesthetic appearance of it.
Yeah, well, I mean, to me, it just makes sense. It just makes sense. Now, looking into the future, this is kind of cutting edge, and we have you guys on here to talk about what is the current state of scar treatments. What are we going to see in 5 years? 10 years. What do you think the future is, Zabine?
It's early right now, but you hear a lot of talk about growth factors in different preparations, as well as potentially even stem cells or derivative products from stem cells. So I think somewhere between 5 and 10 years, I would not be surprised if we start to see products that take that approach and more of a biological approach versus kind of passive with silicone or mechanical with Embrace.
That's interesting. I'll bet we will. We're going to have a show coming up on stem cell therapies in the future. Z, what's your thought? 10 years from now, what is the scar treatment going to look like?
I agree with Dr. Longacre. Just with technology today, you don't know where we're going to be in 5 to 10 years. I mean, not too long ago, to take your gallbladder out, you had to go through general surgery. Now it's endoscopic. So there's so many advances in technology and in treatment. Who's to say? With stem cell technology and research going on, it's open.
All right, Dr. Longacre, you've done so much research in wound healing. Where are we headed?
Well, so 3 points. A, it's interesting that all three of us as guests, and you, Adam, healed without a scar before we were born.
Yes.
It's pretty amazing that the same RNA and DNA somehow makes a transformation. We've peaked as a wound healer before we come out of the uterus, which is disturbing. But second point is, I happen to co-direct with Irv Weissman, the largest stem cell institute in the world here at Stanford, and certainly lessons learned from skin development and unlocking them in the adult are something we can look forward to. And thirdly, it's pretty depressing that since we went to sterile technique, we haven't made much progress. There's still a lot of scars. So this is a really large medical market that we need to do a very good job of. I've been on the needle in a haystack approach and failed many times with one growth factor at a time. We went to the mechanical properties because you impact over 1,000, but I think I agree with the other two guests. A biologic would be great if it's safe and easy, but which one do you target? Of the thousands that are involved. So we got our work cut out for us, but I think we need to do a better job for our patients and for society to say that even a normal scar, remember, we're the only species on Earth that heals with a thick scar, a keloid and hypertrophic scar. So even normal scars, patients want a better job of, and I think products need to address that. So I'm bullish on it, but I wouldn't know which gene and which growth factor to pick at this point, but bioinformatics and big data can help us.
Well, I'm excited for it. I know that guys like you and your lab in Stanford and all over the world are working on this. And, listen, 5 years ago, 10 years ago, we wouldn't be talking about Biocorneum, New Gel Plus, or Embrace. So I know that things are looking up. It's really come down to the end of the show, and I want to give each of you an opportunity to tell us, starting with Sabine, where can we find information about Biocornium, and if somebody wants to use it, how do they find it?
Site, www.biocornium, BIOCORNEUM.com. And as far as purchasing it, we sell it through physicians' offices, plastic surgeons, and dermatologists. On our website, we do have a locator. Patient can put in their zip code and find the physician closest to them that carries the product. And we have about over 2,000 physician offices across the country now.
Excellent, excellent. Z, tell us, where can someone find the new Gel Plus and the whole family of products?
If your doctor is not stocking our product, you can go directly to our website at www.newgel.plus.com, and you can order from us directly.
Terrific. And Dr. Longacre, if somebody is interested in maybe having a scar revision, or if they're having something done and they say, hey, I want to try that new Embrace thing, how do they get that done?
You can go to the website, www.embracescartherapy.com, or you can get to that from neodynebiosciences.com, but the product is Embrace. And we also have a list of the surgeons around the country, over 550 that are using it now. Either way, we can get access to the product for you, the website, or through your surgeon.
Terrific. Well, there's lots of opportunity out there. I want to thank our guests this week, Zubin Meshkampush from Inaltis, Z-Product from New Medical Technologies, and Dr. Michael Longacre from Neodyne. Thanks for joining us this week. We've had a great discussion. We've got lots of good shows coming up. Check us out every Saturday, 12 to 1 Eastern Time, 9 to 10 Pacific on New Reflections shows coming up, talking about skin tightening procedures. We've got a robotic surgery show coming up, non-surgical fat reduction, all of these things in upcoming episodes. Listen every week. Catch us live, 12 to 1 Eastern, 9 to 10 Pacific on voiceamerica.com. This is New Reflections. I'm Dr. Adam Rubenstein. Thanks for listening. We'll see you next week.
We hope you stayed informed and entertained today on New Reflections. Please join your host, Dr. Adam Rubenstein, again next Saturday at 9 a.m. Pacific Time, 12 noon Eastern Time. You can also email the doctor at info@dr-rubenstein.com or visit his website at www.dr-rubenstein.com. And don't forget to join us next Saturday for New Reflections on the Voice America Health and Wellness Channel. Have a beautiful weekend.
Thanks again for listening to the preceding program, brought to you on the Voice America Health and Wellness Channel. For more information about our network and to check out additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the preceding program are strictly those of the hosts or guests and do not necessarily reflect the views and ideas held by Voice America Talk Radio Network, its staff,